Good afternoon, everyone. Today, we kick off our efforts to vaccinate every college student in the state of Ohio who wants to be vaccinated, and our goal is to do that this month, the month of April, just as we did teachers in the month of February. So Fran and I were at Ohio State at the Schottenstein Center today as we really kind of kick off this big effort. We had the opportunity to talk to a number of the students who are being vaccinated, and it's always interesting to hear, what they're saying. Some said they wanted to get their life back to normal. Some said they wanted to have a normal college experience. Some talked about their summer job that they were getting ready to go to and being prepared for that. Others talked about seeing their grandparents or somebody else in the family. So it's always good to talk to young people, and these were young people that were getting the shot for a reason, and they were very enthusiastic about it. So Schottenstein Center continues, Ohio State continues to do a very good job there. Fran and I have been, I think, to 19 different vaccination sites around the state, and yeah, each one is unique, each one is different, but they all are doing really a phenomenal job. And what's so impressive is the number of volunteers that we see there. So very, very, very impressive. Let's turn to our high schools for a moment in regard to vaccinations. This morning, I spoke to our local health departments, as I do every Monday morning. It's mostly listening more than it is talking. But I asked them to reach out to their local schools in regard to the vaccination of 16-year-olds, 17-year-olds, and 18-year-olds who are in high school. And we would like to get as many of them that want to be vaccinated, and would like to do it before school is out this year. So Pfizer, of course, is the only vaccine that can be used to reach the 16 and 17-year-olds. So we know that some of our health departments have already started on this work even before I talked to them today. Some of them had already made arrangements and were working with their local schools to do that. We also know that some of our children's hospitals are doing that as well, and we thank them. So we would also ask our other hospitals to reach out to the local health departments and to the local schools. And if there is a need for extra Pfizer that any of our providers are seeing as they're trying to reach our high school students and to vaccinate them at the school, then we would ask them simply to reach out to us, and we can talk about the availability of that Pfizer, because again, Pfizer is the only vaccine that can be used for those 16 and 17-year-olds. Again, our goal is the same as it frankly is with our college students, and that is to get as many of them vaccinated as we can before the summer starts. And once again, this is entirely up to the individuals. And in the case of the 16 and 17-year-olds, they will have to have, of course, a permission slip brought into school before they would be able to do that. Now I want to talk today about a consolidation of orders. What we're seeing in the state, of course, is a rising variant. Very concerned, as I've mentioned, about what is going on in Michigan. We're seeing this rise, particularly in the northern part of the state of Ohio, so we're very concerned about that. At the same time, we are vaccinating people at a very, very high rate in Ohio. So those are two kind of conflicting things that are going on, and it truly is a race. And so at this period of time, it really is a crucial period of time, and we've got to, continue to do the basics. So the reason we're issuing a new health order now is to make it simpler. We know a lot more today than we knew when this started. For example, the power the power of these masks is so much more, much greater. We know there's so much more greater than we knew even just a few months ago. We've had the long experience of our school year where kids have been in classroom less than 6 feet apart. Somebody comes down with the virus and it does not spread in that classroom. So, really back to the essential basics is what these orders are emphasizing. Above all, common sense. Wear a mask, social distancing. Being outside is always just so much better than being inside. Good hand washing and limiting gatherings of large number of people who are directly with you. So I'm going to now go to Director McLeod. Director, thank you for joining with us, and we'll go from you, and you can talk a little bit about these new orders which are being issued, really clarification. This will cover things such as proms, festivals, graduations. And again, I would just emphasize that it's back to basics, common sense, and these are the things that we need to do as we move forward. And so it's really, we can do about anything we want to do, it's just how we do it. And that really is what we're emphasizing today with these new, more simplified orders. Director?
Thank you, Governor. As always, yes, to your point, the goal here today is to, as you stated, get back to basics, to make sure that we can, in fact, have a smooth path to the return to our lives, and getting folks to focus on those basic principles is going to be the most important thing. Consolidating these orders, encompassing them all into one order, we hope helps focus those important items and get away from any confusion that people may have had about which order applies and where it applies, and really simplifying things and getting everyone to have some responsibility, from organizers of events to proprietors of operations, or to just the public. So throughout this pandemic, as we learn more about COVID and its effects, the Department of Health issued orders designed to protect our citizens. As more information became available, we layered on additional protective measures, and at each turn, we followed the science. As you said, Governor, our understanding of this virus and how it spreads is much more advanced than when we first learned about it in early 2020. We now know there are a handful of key measures that will slow or prevent the spread of the virus. This new simplified order encompasses our previous orders. It streamlines those orders and underscores the most important tenets of infection prevention that stop the spread of the virus: wearing masks, social distancing, limiting large gatherings, and practicing good hand washing and hygiene. And wherever possible, having your event outside. So what does the new order do? The new order continues to encapsulate previous orders and places the emphasis on wearing masks at all times in any indoor location that's not a residence. When you're outside and unable to maintain a distance of 6 feet or more, got to have your mask. And when you're waiting for riding, driving, or operating public transit, taxis, or ride sharing, also need a mask. There are exceptions, and as there always have been, and those are continued to be detailed in the order. Avoid congregating in large groups. So we have the mass gathering limitations, and that's going to be encompassed in this order in a slightly different fashion. We still want Ohioans to take precautions when gathering and maintaining proper social distancing. Keep in mind that smaller groupings of individuals within a mass gathering help limit the spread. The group you're a part of at an event should not be larger than 10 people. How does that work? What does that mean? It means if you go to a festival, if you go to a parade, try to keep your group 10 or smaller, not really congregating with other groups of other sizes, but trying to keep kind of your group size 10 or smaller. When possible, event organizers and managers should provide one-way traffic in buildings or other areas to encourage social distancing. You want to maintain 6 feet of distance from other individuals as much as possible. Individuals, again, back to avoiding congregating in large groups. So how does this work with the 10-person limit? If you're an event where you're sitting or walking, your group of 10 or less should be separated by 6 feet from the next group of 10 or less. If you're at a festival, if you're at a parade, if you're sitting at an event, there should be 10 or less, and there's kind of, just picture kind of a halo around you or that group that you're with, and that halo provides a buffer from the next group of 10 or less. Practicing good hand washing and routine disinfection. This hasn't changed, still a staple of reducing the spread of the virus. There'll still be a limitation on the maximum number of spectators in attendance at indoor facilities, and that's with the 25% of the fixed seating of the capacity. I'm sorry, at an indoor facility with fixed seating to 25% of the capacity of the facility. Same thing, groups of 10 at the most, 6 feet of distance maintained between the seated groups. Still asking that people stay seated when actively eating or drinking at a restaurant, bar, or banquet facility. Information about exhibitions, competitions, auctions, and signage will also be included in the new order, and that'll help simplify the existing guidance. As you said, Governor, we hope by encompassing our separate orders into this one order, we will make them easier to understand for organizers and for those who are attending events. I'll turn it back to you, Governor, and then to Dr. Vanderhoff. Thank you.
All right. Dr. Vanderhoff, you want to give us some of the where we are today and a little bit of the background in regard to these orders?
Yes, thank you very much, Governor. Well, we understand very well that this pandemic has been a marathon for the people of Ohio, and that as we enter into the final stretch of the marathon, the best safety measures are the ones that people can understand, remember, and apply faithfully in everyday life. Today's orders simplify and underline the vital steps we Ohioans need to take to keep ourselves, our family and friends, our coworkers, and our communities safe in this final stretch of the pandemic. Now, make no mistake, we are still very much in the thick of things with COVID-19. Our cases are rising again. Our testing positivity rate is back up above 4%. Our variant numbers continue to grow, and evidence continues to mount that B117 and other variants are not only much more contagious, but also more deadly. But this spring surge of variants is happening here in Ohio in the context of nearly 32%, or 3.7 million Ohioans, having received a vaccine. And more people, thankfully, are rolling up their sleeves each and every day to get vaccinated. And I might add, in a state with a consistently strong track record of compliance with masking in public. The message with these revised orders, therefore, is clear. Simple steps can save lives and put this pandemic behind us. Again, first, if you're older than 16, just as the governor was highlighting earlier, get vaccinated. Remember, vaccines are safe. Much safer than getting COVID-19, whether you're 16 or 80, and they're very effective against these variants. As the director noted, wear a mask in public, avoid large groups, keep your distance, and outside is better than inside. The new orders issued today really provide practical and responsible steps to allow each and every one of us to live and act safely, even as more and more of us get the vaccines that will ultimately put the COVID-19 pandemic in our rear view mirror. Thank you, Governor.
Well, Doctor, thank you very much. Just maybe a couple things to follow up on. As Dr. Vanderhoff said, Ohioans are doing exceedingly well. We look at these numbers every day. We're still running 93, 94% of people in our retail establishments who are wearing a mask. That is statewide. So again, Ohioans doing exceedingly well. With the order, when everyone will see the orders, it's basic. It's really back to basics. We want to make this as simple as we can, with the real emphasis on mask wearing and in distance and staying away from a large crowd. Those are the things that are really really, really important. Let me add one, it's common sense. And again, basic things, and then as you apply it, just use common sense as you do that. Let me go back to the director for a moment. Director, one of the things I might add in regard to, you talked about while eating, stay seated. If you're at the bar or you're at a restaurant, and of course that also will continue to be true if you're at an event, a sporting event or anything like that. Now I know, Director, we're going to get questions about, when these orders, people will actually be able to look at these orders. So we have orders in regard to proms, we have orders in regard to graduation. I know there's been a lot of interest in that. So can you tell everyone what the timing is on those?
Thank you, Governor. The order that we just discussed, pardon me, hopefully it should be available and signed by today. You will also see which orders that wraps into it. And then some of the additional guidance that we talked about to help with this, to help with proms, help with graduations, we're looking to have that guidance out no later than tomorrow.
So that specific guidance will be coming. I don't think there'll be any surprises really in there at all. So thank you very much, Director. We wanted today to really talk about two things. One, the new orders, and two, Ohio Rise. And this is significant, and it's something that I think that we want to take a moment to talk to the people of the state of Ohio about. This really impacts families across Ohio. For too many families in Ohio struggle, far too many families in Ohio struggle to stay together. And in many cases, that's not because of abuse or neglect, which is what we normally think of what breaks families up. But in this case, it's because their children have very complex needs, very complex needs. For example, a child may have a developmental disability and also have a mental illness. Another child may be struggling with a substance use disorder and at the same time has another chronic health issue. For these families, assessing the care that their children need is extremely difficult. Often these families are served by a number of state and federal agencies, and these families are left still overwhelmed and under-resourced. As a result, their children do not really get the care that they need. Too often, families are having to choose between keeping their family together or ensuring their child receives the critical treatment that they need. In a few moments, we'll hear from a father who had to make the heartbreaking decision to relinquish the custody of his child to ensure that child received the treatment that he needed. Certainly no family should ever have to make that choice. There is now hope, though. Today, our youth with complex health needs and their families are one step closer to accessing the right kind of care at the right time. Our first executive budget 2 years ago included brand new funding to support these multi-system youth, what they call multi-system youth. And I'm very grateful that the General Assembly agreed with us, added additional funds to it, and so we appreciate their partnership. Thanks to those resources, our administration has funded and helped coordinate the care of more than 450 young people who have incredibly complex needs. As a result of the program that we started, these youth have been able to get home-based services, residential treatment, or in some cases even a service animal. But whatever that child needed, what they are getting has been tailored for their particular unique needs. We know, though, that there are many other Ohio young people who need and deserve the same level of very intense care to deal with their complex problems. In fact, we estimate that as many as 60,000 Ohio young people may be in need of these intensive services and of this care coordination. And coordination is a real key to this. Many times they're pulling down resources from not just 2, but sometimes 3, sometimes 4 different agencies. Very, very complicated. And so the coordination is very important. We have created, as a result of this need, a brand new program. We call it Resilience Through Integrated Systems and Excellence. That's a mouthful, certainly. Resilience Through Integrated Systems and Excellence, or maybe it's easier to remember, we're calling it Ohio Rise, which will be part of the Department of Medicaid's managed care overhaul. So we're going to talk today about that. It offers a different way to take care of the children who many times we are failing today. The program builds on the success of programs that we previously enacted and it will feature new, intensive, community-based services that will help us serve children in their homes and help serve children in their own communities, rather than in congregate settings that can be far away from the child's home and from the support systems that normally would help that child. Today, the Department of Medicaid is announcing their vendor for the Ohio Rise program that will serve all of Ohio's eligible children. To enroll in Ohio Rise, children must be Medicaid eligible, have significant behavioral health needs, and require enhanced services. Over the next 10 months, Aetna Better Health of Ohio, who has been selected as the vendor, will work with the Department of Medicaid and the entire Family and Children's First Cabinet Council to bring Ohio Rise to life, building up capacity for new intensive care coordination and community-based services throughout the state, so care is never far from these families who are so very much in need. Now I'd like to introduce Mark Butler, a parent from Central Ohio who had to make the very difficult decision to relinquish custody of his son to Children's Services in order to ensure his son received the treatment and care that he needed. Mark, thank you very, very much for joining us today. Thank you for being part of this. And could you just tell your story?
Sure. Thank you, Governor. In 2014, my wife and I were forced to surrender custody of our 16-year-old son, Andrew, when his violent outbursts and behaviors became too extreme to address at home. In addition to autism, Andrew also has a severe intellectual disability. He's nonverbal, and he has several mental illnesses. Now, over the course of his childhood, we worked hard to meet his needs and to create a loving and nurturing environment for him. But after some especially violent outbursts at home and at school, we were told it was no longer safe to have him in our home and that he needed out-of-home residential treatment. Andrew's Medicaid waiver wouldn't assist with that, neither would our family's private insurance. We were told that our only option was to surrender custody to our county's Children's Services Agency. Making that phone call is the hardest thing I've ever had to do in my life. Now, my family, like many in our situation, struggled for so long in silence, isolated and afraid of what would happen to Andrew once we started down that path. That fear turned to sorrow once we surrendered custody and Andrew was sent to a facility over 2 hours away from our home. And I remember that first weekend he was away, we drove down and they told us we couldn't even see him, but we just sat in the parking lot just to be close to him. And that sorrow turned to frustration when I attended meetings and I watched multiple agencies behave almost like they were playing hot potato with my son's healthcare. Now, we visited Andrew every weekend for 2 years. That's over 25,000 miles. That's longer than the circumference of the earth. I'm happy to say that now, as an adult, we have guardianship over him. He's doing very well in a supported living environment. He's happy, and we now have a great relationship with him.
Well, that's excellent news. I think anyone listening to your story, the first thing they were asking themselves is, how's he doing? And so that's a great that's a great thing. And as you know, Mark, this program that we put together, was designed to help young people like Andrew. So thank you for sharing that story with us, and we wish you and your wife and Andrew, your family, all the best. And we appreciate you coming on here and telling your story.
Thank you.
Thank you very much. Next joining us is Abiba Grimes, the CEO of Positive Education Program, which is in the Cleveland area. She spent her career helping children who are struggling and helping the families as well. Abiba, thank you for joining us. We appreciate it very, very much. Can you talk to us a little bit about some of the challenges that you have seen families experience? I know you've been dealing with a number of families. Tell us a little bit about, some of those challenges that you see them face in trying to help their loved one.
Thank you, Governor DeWine. Good afternoon. I think that Mark very beautifully captured or powerfully captured a number of the struggles that we see with youth and families here in Northeast Ohio who are in need of PEP's intensive care coordination services using a high fidelity RAP model. The families that we serve are facing multiple challenges. The needs of their child are presenting concerns in the school system often, as well as in the home. The complex needs that they have may result in police contact and may also result in contact with the Department of Children and Family Services as the family and child are trying to navigate the needs. We also see children who come into contact with our hospital systems. Many of the children that we serve are experiencing suicidal thinking. They are also expressing suicidal gestures and attempts. And so we are seeing that the hospital systems are eager to have partners who can support the needs of these young people without them having to be placed into psychiatric beds or to stay in hospital beds for a long period of time. For many of the young people we serve, they are in need of support from their community, and there are financial barriers to the families being able to access some of those sources of support in the community where the child is living. Our partnership necessitates deep engagement with each of those systems as well as the schools, so that our children are able to stay in their home and have their families not overwhelmed by the needs that are presenting from all of these different presenting problems that include not only aggression toward others, but aggression toward themselves.
I think it's hard for most of us to fully appreciate the challenges that a family faces in situations like you have described. And I would think that a coordinated, holistic approach would give them some assurance that things would work out the best that they could, and that everyone would be kind of on the same page. So maybe you could just talk a little bit about how you think, the Ohio Rise and the coordination might be helpful in this regard.
Certainly. We've been first energized by the cabinet and council that have come together across multiple departments in order to identify what the possible solutions are for the young people that are being served at PEP Connections. The departments can sometimes feel like a silo to the families that are needing the supports. And so they're trying to navigate the school system and the Department of Developmental Disabilities in some cases. They're also trying to navigate, in some instances, the juvenile court system. And so the opportunity for a coalition of programs and departments coming together to design a set of services that are going to work for children and necessitate the engagement and collaboration of each of the different systems assures that the whole child and family can be seen, heard, understood, and supported. And Ohio Rise really powerfully represents that possibility through the collaboration that's occurring in the design of the service and then in the implementation that's being envisioned.
Basically, a coalition coming together to help. I guess that's pretty good way of describing it. Well, thank you very, very much. We really appreciate you taking the time to be on here today, and we're very grateful for you bringing some insight into what this program really will do and why it matters. Thank you very much.
Thank you.
Finally, Jeff Felton joins us today. Jeff Felton is the Director of Belmont County Jobs and Family Services. Jeff, thank you very, very much for joining us today. And you want to help us maybe understand what it means to care for children who have these complex needs. You know, what kind of challenge that poses.
Sure. Thank you, Governor, and thank you for all of the support you and the General Assembly have given to public children's services agencies and the system when it comes to caring for kids. It was much needed and very much appreciated. Mark mentioned making a call. Well, the agency that receives that call is generally the Children's Services Agency, one like mine here in Belmont County. So when we become the custodian, when we receive custody of these children, we are responsible for meeting really all the needs of that child. The basic needs of food, clothing, and shelter, social, emotional, educational needs, and the behavioral health needs. As you are well aware, children coming into our care for whatever reason, generally through no fault of the parents in the cases that we're talking about today, have more and more complex needs, the trauma that they've experienced. So finding the resources to meet those significant and complex behavioral health needs is really a challenge for the Child Welfare Agency. I've told my community many times, we are experts in child abuse and neglect, but when it comes to these complex behavioral health needs, we really don't have that expertise. But nonetheless, it is our responsibility to make sure that those needs are met. We get the phone calls from psychiatric hospitals that say a children is ready to be discharged. And if it's unsafe for that child to go home, my caseworkers start making telephone calls to try to make sure that appropriate services are found. We're not alone in terms of Belmont County in seeing the increased complexity and the number of children with these needs. So we're all competing with other counties for the same limited resources, both out-of-home care as well as community-based resources. Mark didn't mention that we energize the court system. Habiba mentioned it. So not only do they have an opportunity to work with agencies like mine, but they also are involved with court, which is quite a different experience for most of the families that we deal with. So it's quite a challenge to keep the family engaged, involved with the child's treatment, and to try to make sure that we keep the child as close to home as possible and continue to meet their needs.
Well, Jeff, thank you very, very much. You know, maybe to summarize, the point of Ohio Rise is so that these matters don't end up with you. I mean, it's kind of interesting as you describe it. You're used to dealing with neglect. You're used to dealing with abuse. And these are the, you know, the difficult things and the tough things that you deal with every single day. But, you know, in the past, you've been granted custody in cases where there are loving parents, but parents are making that choice because there's no other way to access the different services that child needs. And so we hope that, you know, Ohio Rise is going to eliminate that, and there's going to be fewer of these cases that are coming your way.
Yes, Governor, and you know, it's important to note that we are still a community agency and we can bring forth resources to help these families. So it's not like we're going to be a silent partner or a partner that disappears. We are still a valuable community resource and can assist the kids and families.
Well, thank you very much. Thank you, Jeff. We appreciate it. Thanks for joining us today.
Thank you.
We are ready for questions.
Governor, first question today is from Kevin Landers at WBNS in Columbus.
Hey, Kevin.
Hello, Governor. Hello, good afternoon.
Noon.
My question is more towards Dr. Vanderhoff. There are cases where people have received their first dose of the vaccine and then tested positive a few days later. Is the state tracking that, and how often does this happen? And what are your concerns about that?
Dr. Vanderhoff.
Yes, thank you for that question. The information that we have regarding people who develop symptoms shortly after receiving the vaccine really points towards individuals who likely had the virus, were likely infected and in an asymptomatic stage just prior to receiving the vaccine. All indications are that the vaccine is well received and effective in those groups of people. And there is some early indication, although not enough that I would go too far with it, some early indication that that may actually help boost their response to the vaccine. In terms of specific numbers, I'm not sure our information is that granular, but I can speak in terms of the national experience.
Thank you, Doctor.
Next question is from Josh Rotenberg at Spectrum News.
Hi, Governor. How are you?
Hey, Josh.
We touched back on the new health order. I know that you said that you combined a bunch of different things. Can you just kind of lay out exactly what the new order is? You kind of hit on a bunch of different things.
Sure. Let me go to Director McLeod, who's been working on that.
Thank you, Governor. Thank you, Josh. The order, as you mentioned, does consolidate several orders and transfer some of those important items that we want to focus on into one order. Again, I'm going to say the crux of the order is going to fall to those really most important items: wearing a mask, staying in smaller groups, distancing from others, sanitizing. And then a lot of encouragement and guidance about trying to, do one-way entrances and exits, have things outside when you can. There are several orders that are going to be able to collapse into that. Orders for some of our restaurants, bars, the mandatory requirements for youth and collegiate sports. There'll be a second concurrent order with that outlines all of those. There'll also be just a couple cleanup orders that really aren't necessary any longer, and we're all going to tap on wood here to make sure that they're not. The inventory of ventilators, things like that. So just trying to do some general cleanup. Again, simplify the most important things into this one order, but both of those will be released together. The which orders are being encompassed in there and then would be duplicative. So therefore we'll rescind them because they're duplicative. And then the new order, which focuses really on those 4 or 5 things I just outlined.
So, Director, I imagine what some people are asking themselves as we talk here is what's going to be different, and what's going to be different for the average citizen out there. And I'll start off. I mean, we are making it clear in this order that proms can occur. We're making it clear in this order that festivals can occur. We're making it clear in this order that graduations can occur. And I'll go back to what I said earlier. It really is, we can do about anything. It's how we do it. And
Well
that's
said, Governor.
really going to be I think is the key. So I don't know if you have anything to add to that as far as what is different. I don't know if you have any examples or anything, but as we said, these orders will be out today and they'll be out tomorrow. So.
A couple items that are different. First of all, well said, Governor. It is more about how we're doing things than what we're doing, how we can focus on those simple things. A couple things that might be different that you'll see, we previously had a limit with certain exceptions. We had a limit on mass gatherings of 10 people. This prohibited things like festivals and parades. What we're saying is those things can go forward, but keep your group to 10 or less. So there can be lots of groups of 10 or less, but just keep your group and try to stay to your group. Give some distance between. That may be the difference between a couple, 1 or 2 cases of spread, which we hope doesn't happen. But if it does, that's the worst, and that these events aren't super spreader events. That would be the perfect example of how things are going to be different. We're going to see some of those rites of passages and those things return this year. It's just going to be how we do it and how we do it safely.
Again, it comes back, I think, a lot to just common sense. You go to a church festival, wear your mask. If you're standing in line to get a hot dog or barbecue chicken or whatever it is, just keep a little distance. I mean, none of this is going to become shocking to anybody, but spring and summer is going to look a lot better this year for Ohioans. But it's going to be based on that common sense. But I think the big takeaway is, yes, you can have festivals, yes, you can have parades, yes, you can have graduation, yes, you can have prom, and we're going to kind of outline a little bit how that should happen, but people are going to be able to do that. And look, if a school is planning a graduation, they just use the kind of the basic health principles that they've been following for 9 months. We've got schools, who have been in session this entire year, and they've done a phenomenal job. So we trust them to be able to do a phenomenal job at graduation. We trust them to be able to do a phenomenal job at the prom. And yeah, it's a little different. Two people are dancing and, slow dance. They're going to be obviously closer than 6 feet. We're not stupid. And we're not asking people to do crazy things, but be careful. Just, be careful in how you put on the event. And I have full faith in our schools will be able to do that.
Next question is from Jesse Ballmark at the Cincinnati Enquirer.
Jesse.
Hello, Governor. My question is about people looking for vaccines. Is there a point where Ohio would move towards like walk-in appointments that might be more accessible to certain individuals, or are we going to kind of stick to the by appointment approach?
No, we already have some of those. Madison County, for example, a drive-through. It's my understanding you do not have to get an appointment there. I think you're going to see more and more of that. And frankly, we've been trying to balance. We don't want people standing in line. We don't want them waiting for a long period of time. But we also know there is an interest in people, as we try to get more and more people and get those percentages up, just going into a neighborhood and opening it up and being able to handle anybody who walks up is going to be one way that we're going to get more people. So yes, we're already doing a little of that. We are going to do more of that. If any of our health departments right now want to do it, they can do it. We're going to see other very strategic decisions to go into certain neighborhoods and try that. So absolutely. Absolutely. We wanted to get enough of the pressure off so that we don't end up with, people waiting a long period of time. We've seen that in other places, and we do not want to do that. I think that while some Ohioans certainly have had some frustration in getting the appointment, we think that's going to continue to get better as we get more vaccine in, as we move further with more and more people being vaccinated. We think that will get better as we move. But I think by and large, Fran and I have been in, I think, 19 places. Every place we have been, people who were going through the process and being vaccinated thought it was a pretty good process. So, but we will certainly go to what you're talking about, which is just show up.
Next question is from Scott Hallis of the Xenia Daily Gazette.
Hey, Scott.
Hey, Governor, how are you today?
Good, sir.
Good. Hey, I got an email from a restaurant owner here in Greene County in Beaver Creek, and he was kind of speaking on behalf of a lot of other restaurant owners in the state. A lot of them feel like they're kind of being unfairly targeted by some of the restrictions. The state patrol is fining, going in and citing, various bars and things like that. And they kind of feel like they're being targeted where some of the other big businesses like department stores and grocery stores don't seem to be under as much scrutiny. When can the restaurant owners expect to see some of those restrictions start to be lifted so they can kind of resume business and resume their livelihoods?
Yeah, well, look, Scott, I understand that. I understand that position. The reality is that bars and restaurants are different in the sense that people eat and they drink, and when they eat and when they drink, they do not have masks on. It's the fundamental difference. If you walk into, virtually any retail establishment in Greene County, where you write for the Xenia Gazette, you're going to see 90 to 95% of the people wearing a mask, and they don't have to, and they wear it all the time in there. You go into a bar or restaurant, obviously people will take that off as they are eating. And so that is fundamentally different. And sadly, we continue every single week, while the vast majority of bars and restaurants are doing a great job and comply, we continue to see week after week citations issued for establishments, bars, who are not in compliance. So again, we're not, in any way holding the vast majority of bars and saying that they're not doing a good job. The vast majority of them are, but their business is just inherently different. And that's why we'll continue to have people go out, and this is the same special unit that does it, even before the pandemic.
Next question is from Ohio Latino TV.
Hello, Governor. Can you hear me?
I can. Thank you.
Hello. How are you, Governor?
Good.
Governor, it was nice to see the First Lady supporting you and supporting our community and our state. Tell her thank you for doing her part. Governor, the Latino community is on board. I hear from churches encouraging vaccination. And the question when they call to register are very simple: name, address, date of birth, and so on. That's it. So it's very friendly, the whole thing that's taking place, for what I hear. The majority are on board with the vaccination. I just want to let you know from the Hispanic community, especially in Franklin County.
Well, we have
Governor, my question is, will the coronavirus will be a requirement on the next school year in order to register kids to school?
We have no intention at the state level to require that for someone to go to college or someone to go through K through 12. We do very much urge people to get vaccinated, young people to get vaccinated. We now have the ability to vaccinate 16 and 17-year-olds with the Pfizer. We know that there are trials that are being done for 12 and over. We also know that there's in the process of trials taking place for younger students. So I would hope that, by the beginning of school year next year, we will be able to vaccinate a lot more of our young people whose parents want them vaccinated. We would encourage them to do that. Young people, particularly those who are older, we know those in high school, for example, those in junior high, we know that they're significant spreaders. And we also know some of them have gotten pretty sick. Some have ended up in the hospital. So I think looking at this as something, to prepare for the school year that will begin next August for most students. Most students will go back to high school or grade school in August. And as part of that preparation, thinking about that child being vaccinated is something I hope that parents will think about. And of course, as soon as we know that the vaccine is available and it has been approved to vaccinate students of a certain age, then we're going to do everything that we can to bring that vaccine directly in, whether it's directly into the school or directly into the community.
Next question is from Jeff Reddick at WSYX in Columbus.
Hello, Governor.
Jeff.
On the guidance, the new health orders dealing with festivals specifically, hopefully by the time some of these roll around, this will all be in the rearview mirror, but certainly for some of them it won't. And if we've ever been to Jazz and Rib in Columbus or Pumpkin Show or the Merriam Popcorn Festival, these are very crowded events on the streets. So understanding that the guidance is groups of 10 or less and stay 6 feet apart, is there an enforcement apparatus for this, or is it all on, goodwill and hope?
Well, I think people just need to use common sense. You mentioned those festivals. I've been to all of them. Fran and I have probably been to a more diverse group of festivals across the state than just about anybody. We've been to plenty of festivals over the years. We love festivals. It's just a great part of what makes Ohio different, and you can sort of eat your way across the state of Ohio with some amazing ethnic food and other food. So we love festivals, but I think it really boils down to just people using common sense. I mean, we're again back to the basics. Wear a mask. If you're sitting down and eating whatever you're eating, or obviously you're not going to wear a mask. But we ask people, don't walk around eating. Sit down, find a place. Just basic common sense. I see the director on there. Director, do you want to add anything?
Thank you, Governor. To your point, we're asking, and that's part of the simplification, we're asking everyone to use common sense, attendees, organizers, members of the public, just everyone, if they would kind of help us get through the hopefully home stretch of this together, focusing on those important things. And that's part of the simplification.
I'm sorry, no limits on anything?
I'm sorry?
No limits on attendance or anything like that?
At outdoor events, there is not a capacity limit. Again, there will be limits of those groups of 10 or less, 6 feet apart from each other, everyone wearing a mask and sanitizing. Indoors, still that 25% because the risk is higher indoors.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Governor.
Andy.
Do you believe that with these new orders to simplify things, that it could maybe re-emphasize the importance of masks? Do you maybe believe that you might see more compliance on mask wearing if you take away some of the other restrictions that are currently in place?
Yes. I want to emphasize what we know today. And what we know today is these masks are powerful. And if we can keep at the compliance rate that we are today, it will make a huge, huge difference. It has already made a huge difference. It's hard to calculate and compare us to other situations, but I truly believe that consistently, the fact that consistently from month after month after month, we have been at 93 and 94% mask compliance in all retail in the state of Ohio is a major contributing factor to where we are today. And that if we had not done that, we would be much, much worse off. And so as I look to the next month or 2 months or however long it's going to take us to get through this, I think being able to focus on that is just, absolutely vitally important. My order, is mask, outside, distance. Somebody might put 3 up to where I have 2, but it seems to me that those are things that just drive how we stay safe. Use your common sense, first of all, and understand that the virus is still out there. And, we're seeing an uptick, an increase in the number of young people who have it and the number of young people who are ending up in hospitals. So it's not gone, and we just have to treat it. We have to treat it with respect. That's all. It's like when you're a kid, you talk about electricity or anything. You got to treat that with respect. We have to understand it's still very, very much here.
Next question is from Nathan Hart at WCPO in Cincinnati.
Hi, Governor. On Tuesday, Indiana's mask order is set to expire, and you talked earlier about variant cases coming down from Michigan. I was just wondering, as the landscape of surrounding states' mandates and cases continues to change, are you concerned at all about other states' situations kind of bleeding into Ohio and maybe changing the situation here?
Well, just because a mask order goes off doesn't mean people will stop wearing masks. So we don't know, I don't know frankly, I don't know what Indiana's compliance is now, and I don't know what's going to be afterwards. So look, I mean, we know that, we border a number of states, and what's going on in other states certainly can always have some impact on what goes on in Ohio. I mean, our neighbors to the north, we feel very bad that they're going through what they're going through in Michigan. We also know that can have and probably is already having some impact, at least in the northern part of Ohio. So yes, we're certainly impacted by whatever is going on around us.
Next question is from Laura Hancock at cleveland.com.
Governor, with this new simplified health order, are these mandates or not? Are they just a guidance?
No, the mask order is still on. People, it's not really changed. You'll see in there what has changed. The mass gathering is gone per se. We have, as you know, over the months created a lot of exceptions to it. And so now it's time to move it on and, put in some guidance that is, really consistent with what we know today. That's what we're trying to do. The guidance that we're putting out in the next several days is guidance based upon the medical information, health information that we know today, which is
Go ahead. I'm sorry. Just a really quick follow-up. I mean, are you intentionally forcing the hand of the General Assembly? So if they overturned any of this, they would have to overturn everything?
This does not have anything to do with the General Assembly. This is a decision that we would have made without the General Assembly, whatever, they passed. That this is not influenced by that. This is exactly what we said. We're trying to be clear. We're trying to get back to basics. It's like a football team say, coach says, let's go out there, or, somebody else says to the players, go out and do it. I mean, so I don't mean that I'm the coach, but the point is it's the guidance, and the guidance has to be back to basics. We all have to get back to basics, I think, in what we do. And Ohioans have done phenomenally well in regard to that.
Governor, next question is the last question for today, and it belongs to David Winter of WKRC in Cincinnati.
Hello, Governor. Thank you for taking the question.
Sure.
When the pandemic first began, you ordered that people would not have to look for work if they are collecting their unemployment benefits. And then on December 6th, you rescinded that, but it was only for people who were applying for unemployment benefits after December 6th. So conceivably, the tens of thousands, if not more, people who have been collecting unemployment benefits prior to December 6th still are not required to look for work. Aren't we creating a welfare state by not rescinding that and having people be forced or required to look for work if they are on unemployment benefits?
Well, certainly no one intends to create a welfare state. That's the farthest thing from our mind. Keep in mind that, I'm happy to have our lawyers take a look at this, but we have followed what the federal government has with the additional unemployment. We have followed their rules in regard to the additional unemployment. We followed our rules in regard to our unemployment laws. So I'll have our team look at this. If there's anything more to clarify that, I'll be happy to share that at our next press conference. Thank you all. Look forward to seeing you back on Thursday. Thank you very much.